Creating dialogue across a broad cross-section of stakeholders has resulted in a radical, patient-centred approach to care for NHS Wigan Borough Clinical Commissioning Group, and it is already yielding significant results. The CCG is also focused on the quality of care, from spot-check visits of clinical units to talking with patients to ensure the highest standards are maintained throughout the region. Estelle Matthews reports.
Wigan has one of the largest CCGs in the country, serving a diverse population of around 320,000. Local residents suffer from higher than average rates of social deprivation, alcohol consumption and smoking, and approximately 23% have long-term illnesses. The top priority for the CCG is quality of care, which means reducing admissions and delivering better health outcomes for local people.
I'm a patient. I'm a local resident, and like every other patient, local resident of this borough, I want the best possible care if and when I ever need it. So that for us is an absolute focus. As a CCG, we have created the climate, the commitment, and I think the momentum to make sure that that's at the heart of everything we do. And it'll serve us well in whatever plans we have to put in place for the next 2 to 5 years.
The CCG has created an unprecedented level of dialogue between all stakeholders, but particularly clinicians, resulting in better integration and a sense of togetherness in the approach to patient care.
What we've done is taken the clinician's voice to make sure that it drives all that we do, from the point of view of designing single pathways such as stroke, to expanding that into a multidisciplinary team to look at people with stroke who also then have high blood pressure, chronic bronchitis or diabetes, and the vision is then to take that much further at scale for all of our patients with whatever condition, to provide better care out of hospital, much nearer to home at the right time, the right place, by the right person.
The team in Wigan Borough has brought together different voices through locality meetings and patient forums. The ideas raised at these meetings are taken from the ground level right up to the board, who incorporate the goals and ideas of patients and clinicians into future plans.
These groups, the actual locality groups, can have quite an influence on the CCG. If you've ever wanted to put a point over, these are the best way of doing it, because it will filter straight into the CCG, especially through the CCG forums.
From our perspective, it's about creating the right climate for change. Our focus has been around building the relationships, starting with our patients, our patient participation groups, well established in all our practices. We're now bringing those together so that they can give us a borough-wide view, so that we get a more local view and then a borough-wide view.
The approach of the new CCG in Wigan Borough has had an impact on both primary and secondary care, and this in turn affects the way patients are treated in the area.
I have already seen the difference since CCG came into being. I think it was in April. We now, by close working with the colleagues in CCG, be the clinicians or the managers, I can say to you, I have seen a bright future for our patients. We are already the second best trust in the Northwest, and we are the 5th best trust in the whole of North of England. And that's in terms of quality of care. And this would not have been possible without good relationship, without closer cooperation with our CCG colleagues. We will be able to demonstrate to the other CCGs in the country that that's the way forward.
Wigan Borough CCG is committed to the delivery of excellent health outcomes, and through effective leadership, a clear focus on quality and engagement across all stakeholder groups is achieving maximum improvements in the health of patients across the borough.